I was recently in Korea for the APS meeting. It was a lot of fun, and here are the highlights. In case you don't know, APS stands for Aesthetic Plastic Surgery. It's Korea's largest cosmetic/aesthetic plastic surgery meeting, always held in the spring, and I was honored to not only attend, but actually give a talk. They invited me to talk about the differences between Korea versus US facelift. Interestingly, the surgical techniques really don't differ that much. However, the aesthetic end goal is very different. In terms of surgical technique, the interesting thing that Korea does is they occasionally use thread lifts during surgery to get what they perceive as a slightly better result. Now, you notice I said perceive. I personally don't think it's actually that much of an improvement, but the thinking behind a thread lift, as you know, is really to be able to non-surgically move skin around. We can actually tighten skin. Why do plastic surgeons in Korea use threads? The reason why is the tissue here around the nasolabial fold or just in front of it, technically, even with a deep plane facelift technique, you can't really access it or tighten it. So if you really want to get maximal tightening around the nasolabial fold, you actually do have to do potentially some sort of surgical thread. Now to me, I think that you don't have to do a surgical thread lift or surgical threads to achieve a little more tightness in the nasolabial fold area. I do think that with existing deep plane techniques, we don't have to do it at all. But in Korea, they sort of want maximal tightness there, which is the reason why occasionally they put threads. The other interesting thing in Korea is that they have a much higher penetration of deep plane facelift techniques. Specifically, more plastic surgeons consistently do deep plane, whereas I think the US, it isn't quite there yet in terms of overall acceptance, although I do feel very strongly that it gives you a much better result. Also, in terms of the aesthetic end goal, in Korea, it's important to have a V-shaped face and to have a softer jawline or a more natural jawline, along with not really any prominence along the masseter muscle. In the US, aesthetically, we typically want a stronger jawline, like a very tight jawline, as well as in men. It is okay to have a pretty masculine masseter muscle here or side of the mandible area here, which is a little less common and a little less desirable in Korea. Also, since I've been to Korea and I did a lot of research and talked to my friends beforehand, Korea has a lot more daily post-surgery care after a facelift compared to the US. In fact, there's really no comparison. If you get a facelift done in Korea, you're going to be asked to come back to the clinic every day, probably for 3 to 5 days in a row. I'm not joking about that, because what they want to do is do anything and everything to help reduce swelling and improve any sort of healing. I do think some of it helps, and to be honest, I think some of it may not help or help that much. But if you can get any advantage in terms of faster healing and quick recovery, that is very important in Korea, because Koreans like to work. You only have a limited days off for vacation, things like that. Patients want to get back to work as quickly as possible, which means, yes, they want to book surgery, but they will do anything and everything to go along with helping with healing, recovery, and getting rid of that swelling. The strategies to help reduce swelling and increase healing really don't differ much compared to the US. There are things that may help, including oxygen therapy, hyperbaric oxygen, as well as red light therapy. They also do other things in Korea, such as lymphatic massage, and actually use Korean herbal medications, including pumpkins or pumpkin extract, as well as mugwort, which is a type of natural chemical. They actually burn it near your face, which they think this essence actually helps with healing. Getting on with the rest of the conference, I was able to speak to the founder and CEO of Agnes Medical. They're about to get FDA approval for Agnes Medical Double Tight. So this is an intriguing new device. I'm not aware of anywhere in the world that they have it. Specifically, it's able to do RF microneedling and deliver a liquid or a skin booster, and actually use vibration technology to disperse the liquid. As you know, RF microneedling is a very well-known technology. You have tiny needles, and while the needles are in your skin, we can blast it with RF radio frequency energy, which sort of heats up the skin and helps to tighten up the overlying skin, as well as the underlying soft tissue to a certain extent. With the double tight technology, they're able to then deliver liquid right under the skin right after the RF microneedling. So why is this important? This liquid can be anything you want, and in Korea they have a ton of choices for skin booster. In the US, the only approved skin booster is SkinVive, which is a dilute HA or hyaluronic acid. Now, I do think off-label it's definitely possible to give neurotoxin, some vitamins, other things along with SkinVive, but technically the FDA has only approved SkinVive as the only skin booster I'm aware of. In Korea, they have a lot more skin boosters. I'll talk about that in just a moment. But this is why this technology and this device is so cool, because it's able to deliver different types of skin booster. Finally, there's low-grade vibration delivered right after the skin booster is given, which means that the vibration helps the skin booster, the liquid, if you will, to be dispersed horizontally directly underneath the skin surface. The CEO did tell me that the Agnes Medical double tight machine may be under a different name in the US, but we'll wait to see what happens in the next month or so. Now, in terms of skin boosters in Korea, there are a couple really cool new ones. There's a brand name called Exocleo, which is skin booster derived from amniotic membranes and stem cells. So it comes in powder form, and you can deliver it two different ways, one to skin and one to hair. So if you deliver it to the skin, it's injected just underneath the skin surface, and it really helps your skin to be rejuvenated. If you actually deliver it to your hair, you actually have hair regeneration. This is better for thinning hair because it will help regenerate some hair. It's not really great if you're completely bald and have no hair, then it may not work or may not work very well. You can use any skin boosting technology you want to deliver it, but of course I just talked about the Agnes Medical Double Tight. There are other devices which are able to deliver this specific skin booster or hair regeneration booster. Another very interesting skin booster they have is acellular dermal matrix. So if you're a plastic surgeon or you've actually had breast reconstruction or some type of abdominal hernia repair, you actually may have heard of this. ADM is very well known in breast reconstructive circles. We actually can wrap the breast implant that's used for your cancer reconstruction with ADM, and that wrapping helps with healing and it helps to reduce any scar tissue formation, or helps to reduce it a lot so that you don't have a capsule around your actual implant. What they've done in Korea is they've micronized it. They've actually chopped it up into really fine bits into powder form, or it comes pre-filled in the syringe, and it is very tiny particles of acellular dermal matrix. This could be injected safely just underneath the skin, and this really helps to regenerate the skin tremendously. I think the best analogy I could come up with is sort of like planting seeds in the garden. We have all these chemicals and various biological products which help to regenerate collagen. However, if it's human skin dermis, which essentially is similar to your personal dermis, then it should grow collagen a little better because your body's perceiving collagen in a very tiny droplet form placed underneath your skin. Both of the products I just mentioned are not available in the US yet. So if you have a clinic that offers it, they probably bought it in Korea, smuggled it, and they're starting to use it. As long as you know about it, I think that's fine. But yes, they don't have FDA approval yet. Of course, it's always great to meet old friends in Korea, make new friends. I was able to see Dr. Kevin Chung, the editor-in-chief of PRS Journal, and also Dr. Tracy Pfeiffer, who is the president of ASAPS, the American Society of Aesthetic Plastic Surgeons. So it was great to connect with them and to really listen to the amazing lectures that they had in Korea. So the bulk of this conference is in English. The keynote lectures, and I would say 90% of the lectures, are in English. There are a couple breakout sessions that are in Korean, and sometimes the questions are in Korean and English, so it really depends. The audience is great. Yes, it's majority Korean. However, they do have a ton of people from around Asia and around the world attend this conference. So it's a lot of fun getting worldwide perspectives on plastic surgery and aesthetics. As always, it's a lot of fun going to Korea, and especially to an aesthetic plastic surgery meeting. If you have any comments or questions, fire below. And if you like this video, please watch this video as well. Thanks so much for watching.